Hello, everyone. I'm Rubina Kaur-Singh, a licensed master social worker and KSAC, credentialed addiction counselor with nearly 20 years of experience in clinical mental health and addiction treatment. I am the founder of Reflections with Rubina. I work clinically with Healing Minds with Dr. Singh, and I serve as a professor and counselor for students at Dominican University of New York. Joining me today is Meadows Tariq, a clinical psychologist, addiction specialist, and the founder of Meadows Recovery Center. She is the youngest female to own and lead a rehabilitation center in Pakistan. Today's conversation goes beyond surface level mental health talk and into the systems shaping children, families, and recovery. Today I have Meadows Tariq with me. Thank you so much for joining me.
You're welcome.
Wonderful. So you are the founder of Meadows Rehabilitation Center. Tell me a little bit about Meadows.
Okay. Rubina, basically, I want to share my personal experience why I created Meadows Recovery Center. Basically, my brother is suffering from addiction. That is my motivation to bring a good treatment in Pakistan because we suffered a lot. And in Pakistan, we, lack a good rehabilitation centers. That's the motivation to create a Meadows Recovery Center.
That's amazing. So bringing your own personal life experience, it tells me that somebody who would come to Meadows for treatment is coming because it is a personalized family experience.
Yeah.
So you're going to treat you're going to treat your clients just like your own brother or sister, family members.
Yeah, basically for me, it's not only a case. For me, there are the people, they belong, they are families, they are sons, mothers, daughter, and we treat like that.
Like family. So addictions is really special to your heart.
Yes, that's true.
That's amazing. So I too went into addictions many years ago because my father's a psychiatrist and so is my sister, and I followed their footsteps in becoming a social worker. And I would watch my father work with clients with addictions, and it would blow my mind. And I wanted to be a part of that healing process for people. And there's such a reward in it too. So tell me about the reward for you. Has your brother overcome addictions? Is he still fighting it?
He's still fighting it because, addiction is a process.
Yes.
It's not something which we can treat. It's not a curable disease. First of all, you need to understand that addiction is a manageable disease. We have to fight for whole life.
Absolutely, absolutely.
And I want to ask you, what brings you in this field, and why you created Reflection with Rubina?
So, Mavish, actually, I would watch my father and he would come home and I would be wild-eyed. And my sister and I would listen to stories about him in the emergency room and his clients with addictions, mental health, schizophrenia, depression, anxiety, grief. And we would listen to these stories and he would come home disheveled after going in all suited and booted. And so this intrigued both of us sisters so much that today she is a well-renowned American board-certified psychiatrist, and I am a licensed master's clinical social worker, also a professor. So those experiences from my childhood helped me create and found Reflections with Rubina, and my sister created and founded Healing Minds by Dr. Singh. So the two of us work side by side together, and we are what you can probably call a power team. Us sisters, some of our clients even call us the Singsters. So that's how I started. But Reflections came recently, more so recently, because I felt that it's important to reflect your experience onto your clients and your clients' experiences onto you as a therapist. So I like to help and heal people, and I wanted to reflect my healing abilities onto people, similarly to like what you're doing.
Yeah.
You have healing capabilities, which you used towards your brother in his addiction.
Yes. So okay, Rubina, I mean, in USA mental health industry, there is a very flaws. like there is a consent from the patient. Do you think it's a good for the patient or the families, like a patient who is suffering from the schizophrenia, how he can decide to take care of himself? Because you know that in schizophrenia a person is totally disorganized and away from the reality. So how USA treatment industry effect on that?
So let's start off by explaining to our viewers what schizophrenia is. Schizophrenia is a mental health diagnosis, which is in the DSM um, diagnosis. Yeah. So we are following this in America. We're following it by the American Board Certification of Psychiatry and Mental Health. So what happens is that a person who has schizophrenia is coming out of their shell, and unfortunately it shows up when an individual turns around the age of 17 years old, 17, 18, similarly to bipolar disorder as well. And so what happens is that they start to hear voices. They start to get told what to do. So they'll start to hear a voice in the back of their head. So just think about us having a conversation right now, and somebody is in your ear saying, go kill yourself, go kill yourself. You're ugly, you're horrible, you're fat, you're stupid. So there's this voice in the back of your head saying this to you as I'm trying to have a conversation.
Yeah.
And this whispers in the back of my voice, in the back of my head, how can I have a conversation? So most of our clients will turn around as they're talking to you and having a conversation, and they'll be like, stop it, leave me alone. And then that outburst looks crazy.
Yeah.
The people of our society don't understand that this person is struggling and suffering from a mental health issue. So it's a very important topic that you brought up about consent. So what is consent? Consent is to give permission, right?
Yeah.
So permission is very important for us to give. But if you think about it, there are laws with the National Humane Society, which doesn't allow you to force somebody to do something, right? Unless you are a threat to yourself or to others. So unless you are planning to commit suicide or to commit homicide. So because of those reasons is why those Humane Society laws are in place. But now family members bring clients to me all the time. Just recently, actually, this really amazing young boy came to me. They called from the hospital and they asked our office if we would give them an appointment for therapy. And my list of clients is very long, the waiting list. And they asked me to bump this young man up to the top of my list because they couldn't get him out of the hospital. They needed to have some kind of discharge aftercare appointment. So I'm just that type of person, the type of person healing that wants to help everybody. So I gave him an appointment. I stayed till 8 o'clock at night and at the office, and he came, and he was angry looking boy, very angry looking boy, came with his father, huge, big guy. And he was misunderstood. He was treated like an animal in the hospitals, right? You may have seen this in your practice as well.
Yeah.
So because of the way he was behaving and being told that, all these voices in the back of his head, he was acting out. And then they had to call the police, and he had to be shackled and taken to the hospital forcefully because of his behaviors. So this is where the consent takes you to the hospital. So there are ways around it. But we have to learn to, coexist with psychiatrists as well as psychologists and social workers and therapists, because it's not just medication management, it's also talk therapy. Because if you don't get your mindset right, then how are you going to set your mind on something? So you have to set your mind to something, especially something like recovery and addictions, even mental health, grief, any of those. So at Meadows, what kind of clients are you seeing? How are you getting your clients?
Okay. Let me I want to talk about a little bit schizophrenia first. Like
Sure.
talked about the hallucinations and the delusions they suffered from during the act of schizophrenia. But the thing is that in schizophrenia, we are away from the reality. As someone, his prefrontal cortex is not working properly, and you know that we still don't know what is the exactly reason behind the schizophrenia is. It could be maybe the level of dopamine increase or decrease, and but still levels, yeah, but we still don't find the exactly reason behind the schizophrenia. And the age, the start, it's as you mentioned 18, 17, and in some cases in the 14 as well. Yeah, so where and schizophrenia is very quiet disease. It's not come like, it's not start from the people starting hearing a voices on the really first place. Right. There is a behaviors, little behaviors like the hygiene problems. Absolutely. And it is. The isolation and withdrawals from the society and from the home, and also there is a paranoia as well. And but the thing, my question is that a person who is suffering and he's unable to take decision for himself. So as a society, um, USA cannot allow you and the family members to bring him the treatment.
So that's not entirely true because, like I said, this young man was under the age of 18. So the parents are the ones who will make the decision for this child still, right? Because we're still in our adolescence at 17. So, yes, you can be brought by your family members, by the hospitals, by the police departments. So there's different methods of bringing the treatment to the client. Of course, the first thing is the client has to be willing. And to be willing, you have to meet somebody who is meeting you
If
at
the
your...
client is not willing, the thing is that schizophrenia is a disease where client is unaware.
So-
Because to him, whatever he's thinking and hearing, it's true for him.
Unfortunately, not everybody is able to be treated and healed. So in a city like New York City, where I come from, you will walk down the streets of New York and you will see homeless people talking to themselves, yelling, screaming, throwing bottles at people even at times. And it's absurd.
Yeah.
But there are different things. If they're being, again, a harm to themselves or to others, then there is no consent at this point.
Yes.
Now we are looking at the safety, right? The safety aspect is very important. So once we have that safety aspect, the police can intervene, social workers can intervene. And once they're taken to the hospital has an obligation to help this client. So they will get them the right medications, they'll get them the right kind of treatment, and even food, shower, just hygiene, like you mentioned, which is so poor at this point. These things will all be affected. And the United States has so many governmental programs, which fortunately and unfortunately, due to the administration that we have in office, plays a major role in mental health treatment. So a president that will come into a Republican Party that will come into the United States in office may have less desire to help in mental health. So funding gets cut. That's the hardest part.
Yeah.
So funding is where the lack is. And there might be another party that will come in, and then all of a sudden mental health is the prime focus of getting people well. But at the same time, people like yourself, we don't stop because of funding. We don't stop because of, what
Because
to do.
we can understand the pain.
Right, because it's so personal to us. So, it's personalized. So that's where a social worker, a clinical psychologist gets burnt out. And that's where we get so tired of helping people that we ourselves burn out and we don't take care of ourselves. So self-care in our field is number one for me.
Yeah. It's a key, basically. Yeah.
So just to say about consent, to go back to close that up. So consent is possible with the right kind of people. So like I said, this young man who came to visit me in my office, I didn't treat him like a client when he came in. I treated him like a friend, like a little brother. And when he came, instead of talking to him about his problem, I was making friends with him. So I made friends with him. And I wish I could show you my phone right now, but as he left, he sent me a message on my phone saying, "Thank you, second mother," and wrote a heart. And he said, "You're just like my second mother." And he said, "I really like talking to you because you didn't make me feel crazy. You didn't make me feel like I was sick."
Okay. You make him safe.
Exactly.
Yeah.
Safety in our field, for our clients to feel safe is so important.
Yeah.
They need to know they're safe. Likewise, like your brother, going back to your brother, feeling safe that I can trust to talk to whoever it is about my problems. And, to go into another segment of this, you're talking about safety, but childhood trauma. We don't know what kind of trauma your brother or anybody, I don't want to keep going back to your brother, but we don't know what kind of trauma as a childhood, in our childhood or as a child even, that we've faced. And that trauma is what carries forward into our adult life with addictions.
Yeah.
I'm sure you've seen this.
Yeah, that's true. The interesting thing is that in my brother case, he has basically bipolar, which misdiagnosed as well. So we suffered a lot. He relapsed in the multiple times because of um, the rehabilitation centers. They never guide us. They never give us proper diagnosis. They never tell us what kind of problem he's facing. They never give us the aftercare programs. Due to that, we suffered a lot.
So are there aftercare programs in Pakistan? Because what are they?
Not really, but in that's why I created Meadows.
Okay.
That is the reason, because addiction is not something which is we can fix like immediately, or like it's not a fever.
It's not
You can take the medicines and it's gone. It's a process. It's like a child, it's born and then it sits and then walk. It's a process. Addiction recovery is a process.
Yeah.
So that's why I created Meadows, where we offer different kind of programs. It's a long term and short term, and plus aftercare program is a very important, and we help them on every step.
Do you guys have group therapy sessions?
Yes, we have.
Those I find are very, very
It's a very important and good way to socialize and open the doors for them to reconnect the world as well. It's very important.
And not to feel alone, right?
Yeah.
I mean, if I was alone in my mental health issues, then who would I talk to? That's where the suicide rates become higher.
Yes.
And homicide even, because there's anger, there's fear, there's rejection, there's abandonment. So those are the things I've
In
noticed.
group therapies, every client bring their own experience on the table. So everyone share the same trauma, same kind of problems. So it's helped them to heal.
Yes.
And we also, there is a art therapy that's very important to express yourself without saying something. Express your emotion through art, through colors, and we work on the lifestyle change. Medicines is a temporary, and the real treatment is the lifestyle change that supports your recovery. So yeah.
So I believe that lifestyle changes are priority number one.
Yeah.
But I also believe that medications help a lot as well. And the reason why I say that is because people are scared to take antidepressants or antipsychotics. They're scared to take it because they feel like now I'm going to be labeled as crazy, right? So, so it's sad for me to see that people reject medications as well. I'm not a pill pusher, so I'm not one to say you need medication. But when somebody needs medication, I will say to them, like, I really think, we should try both and interconnect the therapies together. That I find very helpful. And that is where my sister and I both come in together and we work together in our office. Whereas I will be doing therapy weekly, once a week, because we don't really we were doing group therapy at one point, but I do weekly group individual therapy. and she does monthly medication management. So she only sees the patient once a month, whereas I see the patient weekly, and I see the changes that the patient is exploring in their own life, and I see all of those brilliant day-to-day changes that they're bringing within that week. And so even sometimes the downfalls, I'll see like they're getting more depressed or they're feeling more anxious. And so the good thing is that we interconnect together and we bring the levels of, say, medication needs to be increased or lowered, or we need to change a medication. So that helps the client not get over medicated, because when you just go to the psychiatrist, they don't spend much time with you. Have you noticed? I mean, I don't know how it is here in Pakistan, but have you ever noticed that they'll spend maybe 10, 15 minutes with you and say, oh, okay, what's going on? Oh, okay, bipolar. Okay, so you're having thoughts. Oh, you're manic. You're too excited. You're too hyper. You go from highs to lows. And they just quickly ask you those trigger questions and you answer them and they're like, okay, yes, you're bipolar.
Yeah.
Right?
Yeah.
But did they actually spend time with you and do a biopsychosocial? They should be, right? And do they actually know what happened in your childhood? Why you feel like you've been abandoned by your family? Why you feel like, going to say to your brother, maybe he felt abandoned in his family at one point. Maybe he felt abandoned amongst his friends, his peers. And that's something that stuck with him. And that pain that he was in carried into his adult life. And how did he shut that pain off?
Yeah.
He used drugs to shut the pain off, right? Because there was nobody telling him, you're depressed, my friend. You're depressed. Let me just give you something, a light antidepressant, which will help you with the depression.
Yes.
And you don't have to use alcohol, which is a downer. Even worse, right?
Yes, you're right, Rubina, about the people refuse taking medication. There's a one other way. People also think maybe they become addicted to medications. They also have that fear as well. So I think, yeah, both are very important, like medications, therapy, and the lifestyle change.
Absolutely.
It's a best
Lifestyle is,
combination, basically.
yes. And, I believe in the growth mindset. I don't know. I feel that the growth mindset is such an important part of, so Maslow's, hierarchy talks of growth mindset. And so the growth mindset changes our mind. So we use CBT, which is cognitive behavioral therapy. I'm sure you do too. And we want to change our negative thoughts into a positive. So there are times that even you and I say, oh, I can't do that. I'm camera shy, or I can't lose weight, or whatever it may be, right? But that's not true, right? We can do anything we put our mind to, right?
Yes.
So if I say I can lose weight, then I will. It's manifesting and putting it out there. So I believe that mindset needs to be changed, that negativity needs to be removed. So instead of saying I can't, I would say I haven't lost weight yet. Now, by adding that word yet, the power of yet, that leaves a tiny little hole for us to rip open the mask of shame and whatever it may be that we can't move forward in. So if there's that little tiny hole, power of yet, then we leave it open for possibilities and availabilities for us to manifest and bring into our life positive changes. So those are I think the change in mindset that you're talking about, the lifestyle changes.
Yes, yeah, that's very important.
What lifestyle changes have you seen in your practice at Meadows with some of your clients?
Okay, it's very important to sleep patterns. Good sleep is a very important, and in my experience, I see a people who focus on the good sleep and sleep at night that reduce the relapse chances. It's a huge thing.
So if they sleep at night, they've reduced chances of
Yes,
relapse.
because most of the people do drugs at night. So
Party life.
yes, so that's why if we have a good sleep, and like a whole day, how every day is planned, good sleep, wake up time, breakfast, we have to physical trainings. Routine is a very important.
Routine is important.
And in recovery is important. We should become a schedule based person, not an emotion based person as well. That's very important, I think.
Okay, so time management is
It's a very important. It's a very big skill as well.
So you teach time management?
Yes, we do.
Okay. So what are some of the ways you teach time management? I mean, do you help your clients make a schedule? Do you sit with them one-on-one and figure out how to?
Basically, first of all, whenever client came into Meadows Recovery, we assessed properly with the therapist, and after that, he met with the psychiatrist, and they both, first complete his assessment, and after that, we create a personalized treatment plan according to need based, because everybody have a different experience in his life, so we cannot implement a same treatment plan on everybody. That is a very important thing, because everybody have their own experience, traumas, and life experiences. So according to that, we create a plan, and eventually we help him to how he can implement on that, and how he can become a happy and satisfied person, even he's in the rehabilitation center.
That's amazing. That's really amazing.
Because rehabilitation is not a prison.
No,
Basically,
it shouldn't
it
be.
is a place where you can rebuild yourself. The meaning of the rehab or a rehabilitation, it's a rebuild, right? But because of the malpractices, there is people have a fear to come in rehabilitations, and it's people think it's not a healthy place, but even it's the best place to take a pause from the noisy and the rushy and lifestyle of
The chaos
yes,
of
the
the way.
chaos. Yeah.
That's really great. And so at Meadows, is it, when somebody thinks of a rehabilitation center, they think of like metal framed beds and chained walls and bars on the windows. But Meadows doesn't sound anything like that. Meadows sounds so serene and peaceful.
Yeah.
So what is the image of Meadows? I'm sure we can all look at it up online.
I always say it's a home away home. It's a home where you can live happily. It's not a prison. It's not something where you can um chained and lot of as you told me, as you are saying that uh it's not something horrible and scary. It's a very peaceful.
And you guys treat them like family.
Yeah,
Because you've built the foundation on such a powerful, loving relationship. I mean, your brother sister relationship is so powerful.
No, that. Yeah.
And the love a sister has for her brother, that just shares to me that I would want to send one of my loved ones to Meadows. I mean, because knowing your ideals, and that's how I work with reflections as well. Many years ago, an experience I had was one of my best friends experienced a manic episode. And I was 17, 18. And her mother called me and said that you have to come. I was living in another town 5 hours away. And she called me and said, you have to come. She wants you. And the second I walked into her house, I noticed there was nothing left in their house. Her mother had gone away on vacation for a week. And before her mother came back, she threw away all the TVs, all the furniture, like everything was gone from the house. And I was like, Auntie, what's going on here? And she looked like she had the devil inside of her. She was talking such weird things. And I was like scared. And I was, even though my father had told me about these kind of cases as a childhood, to see my best friend, my childhood best friend growing up, suffering, struggling. But you know what's amazing is that her mother did not stop and got her the right treatment. Believe it or not, I took her to my parents' house that night with her mom in tow. And we went to my dad. And I was like, Dad, help her. And we sat and talked about it. And we decided a treatment plan within the home only because that's how much I had, the love that we had. And believe it or not, I'm still friends with her. She is happily married, has a 2-year-old little boy, so beautiful. She's on the right treatment regime, and she's the same friend that I had from when I was 13 years old. Still today. I just met her. She and her family came to my child's birthday party right before my trip here. And
Actually, she got the right treatment.
she did. She was fortunate enough because she had people behind her, like yourself or your brothers, to support that. So we have to be that mother, that brother, that sister for our clients. It seems that we have to do that. Yeah. And sometimes we have to be a little bit hard on them too, right? Tough love.
It's important.
Did you have to have some tough love on your brother?
Yeah, it's it's very important, tough love, because it's important for the patient, a person who is suffering, because I think it's very important, because we need to put our emotions parallel and take a decision according to merit and the need based.
Yeah, absolutely. So that's how you start, by finding that need for your client. So I do similarly the same thing at Reflections. I don't just want to know the client as a client. I want to know them as a person, who they are, where they come from, why they feel the way they feel. I have a client who comes to me. When she came to us, she has borderline personality disorder. I have several clients with borderline personality disorder. But this one client called the office in anger so many times.
Okay.
And she was angry because I didn't have availability. Like I mentioned to you before, I have a waiting list of clients. And unfortunately, I just couldn't find that spot for her. And she was so angry that she yelled and cursed at the secretary. And the secretary asked me, "What should I do, Rubina?" And I said, "We're not going to take somebody who's abusive to our staff." And because we are an outpatient, so we have the monopoly in the sense there that we can, because mental health is so widely accepted and not enough providers to treat. So unfortunately, she struggled in making an appointment.
Mm-hmm.
And she called so many times, Mavish, so many times, that finally I said, "You know what? I have a cancellation. Put her in this spot." And she came to me. And I was like, "Oof, this is going to be a tough project." But do you know, this was 3 years ago. She came to me, and just by meeting her at eye level,
Okay.
and understanding her pain and not sympathizing, empathizing.
Yes.
Because sympathy is not good. Have you ever seen that video of Brene Brown? Have you ever, the psychologist Brene Brown? She has a video, and I'll share it with you, the link, and we'll share it in the comments as well. The video is called Sympathy versus Empathy. It's really a off topic, but that's a beautiful video to watch for a few minutes. I share it with my students all the time. But when I came down to her eye level with her mentally, she was able to open up to me. And you would not believe this woman who is screaming, angry, cursing in my office. And today she sits there and she talks to me about everything in her life. Calm. And I said to her, "Did you see what your life was like a year ago? Just turn around and look." And she goes, "Rubina, I'm a different person because now I have somebody to talk to who not only understands me, but doesn't judge me, doesn't tell me what to do." I'll never give advice to people because I don't want to give advice. If I give advice and it doesn't turn out to go the way that I advised, then the next time they have something, they're going to be a little bit hesitant to talk to me. They're going to feel ashamed to talk to me. So I don't give advice because I want to keep it very natural and neutral. And that always brings my clients back to me week after week after week. And, there are times I have to miss appointments and she'll yell at me. She'll text me, "Rubina, did you forget about me?" I said, No, I'll never forget about you. You're one of my core clients. So as I go back, she's I have to see her the first day I get back. I get off the flight and I'll go home and take a shower, and she's one of my first patients on the list to see that day.
You talked about the borderline personality. What do you think? Do borderline is misdiagnosed as well?
Well, yes, of course, right? Because what is borderline? We're not sure. It's not this nor that,
Yeah,
or
it's a
it's
word.
both this and both
Yeah.
that, right? So borderline is very confusing because the person who is borderline will say, "That's not me." But then in 3 seconds, they'll turn it around and be like, "That is exactly what I am. I do that all the time." So I've noticed that borderline clients are very needy. Very, very needy.
For attention,
Yeah, of course.
validation,
Validation, attention. What else do you find?
a love,
Oh, yes, love. Love is the hardest one, right?
right?
It's hard when you don't get acceptance in love.
Yes.
I mean, I think more than love, even, I think acceptance and to say like, so I have a borderline client who comes to me weekly, but she forces herself to come twice a week. And then she'll call me and text me nonstop. And I'll ignore her calls because she knows that she has a standing appointment on Fridays at 1:45 p.m. in my office.
Okay.
Without fail. I don't cancel my appointments. I try not to. And she knows she has that appointment, yet still she'll call me, and dinner time, 7 p.m., she knows it's dinner time. And then she'll come to my office and say, "I know, I'm so annoying. I'm so sorry that I keep calling you." And I said, "It's okay. You can call, but I'm not going to answer." Because 7 p.m. is the witching hour in my home. And so I have to take care of myself and my family, which is part of my self-care routine, right? And so I cannot speak to you. So I have to set those boundaries with her. And that's where her borderline suffers, because she never got that validation and that acceptance from her own parents, her own brother. And they always looked at her as the lesser of the two children. So that was her childhood trauma. She faced many traumas, actually, but she never was accepted. And even till today, when she spends too much money, her mother will text me and say, "Rubina, you need to work on money management." And she'll be in a group chat, and then she'll start yelling at her mother, "Mom, stop texting my therapist for everything." And then I won't say anything, but then when she comes to my office, I'll say, "Well, don't you text me for everything? You're texting me for everything as well." So validation, love, acceptance, dealing with those traumas is very important as well.
And do you think maybe she feels safe with you?
Of course.
That's why she's
100%, 100%. She doesn't really have too many friends.
Yeah.
And so when it was her birthday, I I told her to come to my house. She came to my house and I had picked up a birthday cake, some balloons, and because I knew she had nobody to celebrate her birthday with. And so I told her to come, and my kids and myself, we celebrated her birthday, and she's so sweet. She even dressed up as Cinderella for my daughter's third birthday party.
Okay.
So
nice.
the love gets built, and yes, somebody would say that that's so, that's crossing a boundary with your client.
But I think it's sometimes it's not about the crossing the boundary. It's about the feelings the client have, the safe feeling.
Yeah. So ethically, one should never cross that boundary as a therapist or a psychologist. We've been taught that is ingrained in our brain, right? That we are not to become friends with them. But there are some clients who become family. They don't even become friends. They become family. And that family, you just can't abandon them when they need you.
Yes.
And so I find it is very important that when she was alone on her birthday, it was important for me to acknowledge, to accept, and to bring her into a loving world. So she knows she is safe, and she knows she is loved, and she's happy. And she looks for me. She waits for me. She asks me. She makes her major decisions in my office, And so that heals her traumas, and that helps her to make better decisions for the future, because she knows that I have this person, or I have these teachings of this person. So we have a very funny joke in my office. It's called, the bracelet is called WWRS. And how that came up is my son and I created a bracelet for one of my clients after he told me that he sat outside of a liquor store and had an argument with me. And I said, no, you didn't. And he said, yes, I did. And I said, what was the argument you had with me, which I don't remember having with you? And he said, well, I sat there outside the liquor store and I looked at the liquor store and I said, I'm going in to buy a bottle of vodka. And he said, you answered me. No, you're not. And he's not schizo. He didn't have voices. But he had this conversation with himself, with me. And he kept asking himself, what would Rubina say? What would Rubina say? So my son and I created a bracelet for him that was one of those little beaded bracelets. And we put the letters WWRS on the bracelet. And he wore that bracelet every single day. And every time he would have the desire to go have some drinks, he would say that that bracelet was a reminder for me. And I would always ask myself, what would Rubina say? So now hundreds of my patients wear this bracelet, which my son and I have, with a lot of effort, made bracelets. But it's the running joke now. What would Rubina say? And so my clients, I ask them when we have conversations, well, what do you think? I never tell them what to do. What do you think?
Yes.
And so they'll always say, well, I always ask myself, what would Rubina say? And I say, well, what would Rubina say? And they'll say, well, Rubina will say, ask yourself, is this important? What would happen if you did this? What would happen if you did this? What is the balance in the two?
Okay.
And so when they have these thoughts in their mind, I'm telling them how to work through their future issues by asking them, well, what would Rubina say to you? And then it just becomes automatic. And they don't have to keep saying, what would Rubina say? Now it's automatic. Now it's an automatic thought. And now they will progress with their future, even if they don't come and spend time with me weekly. So those relationships, especially for borderline clients, are important. But honestly, they're important for you and I as well.
Yeah.
You need somebody to talk to as well, right? Don't you have hard days, Levish?
Yes, we all have.
Right?
We all have. Yeah.
I have hard days, and I have a really good friend who I'll call, and he'll talk me down from my own negativity and tell me, sir, you're thinking too much. And then I have to remind myself, yeah, I am thinking too much. And I have to bring myself down to, and this good friend of mine will remind me to, think positive, stay on track, because we
But sometimes
all need that.
difficult for us to think positive all the time because we are human being, and sometimes it's not negative and positive, it's a neutral as well.
Well, that's why we also need therapists.
Yeah.
I have a therapist. Believe it or not, I have a therapist. He's actually a very famous therapist, and he helps me through all of my life. I talk to him about my cases. I talk to him about my relationships. I talk to him about silly things that have happened within the home. And we'll joke even. And we spend that hour weekly talking about these things because this is my self-care. Mavish, it's important for us. It's vital. It's not important. It's vital for us to have self-care. So going for a massage, getting your nails done, getting a facial, even just going for a walk, drinking enough water, having therapy sessions. These are all part of a self-care routine that I follow. I may not be the most time regimented person because I'm always late. But I'm definitely regimented to my routine of self-care and mental health.
Okay.
Because if I don't keep my mental health, I don't keep those cobwebs, they're not dusted.
Yes.
I cannot help anybody.
That's
So yes, you're right. It can't always be that you have to be positive and
negative.
And
I
you don't-
think it's a neutral.
you don't even know. We can't always say that we have the answer to everything just because we're psychologists and therapists. Like we can't. We don't have the answer. So sometimes we need good people in our life to be that when we have those neutral days to kind of remind us of the good and the bad that have happened and to be grateful. So I'm reminded by this good friend of mine and say, hey, do you remember about those days that you spent crying in your bedroom? And I'll say, yeah. And he says, well, look at you now. Because I'm human. I cry too.
That's true.
Have to, right? You have to have that. You have to have emotions as well. So those vital, important emotions and And self-care feelings are very important to have.
True. That's true.
So it's been a pleasure to talk to you. I'm really enjoying our conversation. I hope we can have more conversations. And I'd like to talk more about the drug addiction pandemic that is happening not just worldwide, but in Pakistan, in US. I'd like to talk more about that, but we can, I think, next segment, we
yes.
can talk about that.
Sure.
Wonderful. Thank you again. It was a
You're
pleasure to have you.
Same.
If this conversation hit something in you, don't ignore it. Awareness is the first step. Action is the next. Thank you for watching Reflections with Rubina. And thank you to our guest, Meadows Tariq from Meadows Rehabilitation Center, for showing up with honesty. I'm Rubina, your therapist and life coach. Reflect, reset, do the work. We'll see you in the next conversation.